Fat in the liver, these 5 foods are the bomb. There's no doubt that you've heard about fat in the liver. It's so common and most of us don't know that we have it until it gets diagnosed accidentally. Even though this condition, fatty liver, is more common in people who are alcoholic, there is a non-alcoholic version which can be present in any adult despite gender or age. Common risk factors for fatty liver disease include obesity, type 2 diabetes, high blood pressure, and rapid weight loss. When you hear those chronic diseases, you must also feel that diet has something to do with the condition. And it's true. Diet plays a crucial role in the development and management of fatty liver disease. The impact of food on fatty liver disease is primarily related to how certain nutrients influence fat accumulation, inflammation, and overall liver health. This is why we're listing out 5 foods that can pave a path for fatty liver disease. Number 1. Sugary foods and beverages. High intake of added sugars, especially fructose, has been linked to an increased risk of fatty liver disease. This includes sugary sodas, sweetened beverages, candies, and desserts. Number 2. Fried and processed foods. Food items that undergo deep frying or extensive processing, such as fast food, potato chips, and packaged snacks, are typically rich in unhealthy fats, trans fats, and additives. These elements can contribute to weight gain, non-alcoholic fatty liver disease, and liver inflammation. Yes, we banned 2 of your most favorite food items. And now let us tell you why this fatty liver is risky. Fatty liver disease, especially in its early stages, may not always present noticeable symptoms. When symptoms do occur, they can vary in severity. You might experience fatigue, weakness, weight loss, swelling, and pain in the right upper abdomen, and even jaundice. Over time, this disease can cause more severe conditions, such as inflammation, scarring or fibrosis, and cirrhosis, which is extensive scarring that can impair liver function. This is just a reason for you to avoid the rest of the food on our list. Number 3. Refined carbohydrates. Refined carbohydrates such as white bread, white rice, and other highly processed grains can lead to an increased risk of fatty liver disease, as they can make your body resistant to insulin. If you already have fatty liver disease, these refined carbohydrates or processed grains might worsen the condition of your liver. That's why choosing whole grains is generally a healthier option. Number 4. Red and processed meats. The excessive intake of red meat and processed meats, including bacon, sausages, and deli meats, has been linked to an elevated risk of liver disease. These foods are typically high in sodium and unhealthy fats, contributing to liver inflammation and damage. It's advisable to opt for lean protein sources like poultry, fish, tofu, or legumes. Number 5. Excessive alcohol. Alcohol is a well-known contributor to liver damage, and excessive alcohol consumption can lead to alcoholic fatty liver disease. The liver metabolizes alcohol, and prolonged or heavy drinking can result in inflammation, fatty liver disease, alcoholic hepatitis, and even cirrhosis. If you have fatty liver disease, it's important to limit or eliminate alcohol intake as advised by your healthcare provider. Limiting food from these 5 categories will help keep your liver healthy. As you are eager to watch till the end, here's another thing you should be concerned about. High calorie intake. Consuming an excessive number of calories, leading to weight gain or obesity, can also contribute to fatty liver disease. So maintaining a healthy weight through a balanced diet and regular exercise is important. This is why for overweight or obese individuals with non-alcoholic fatty liver disease, the initial treatment approach involves gradual weight loss achieved through a combination of calorie reduction, exercise, and adopting a healthy eating pattern. So now you know what you have to do to keep your liver free from fat.